Good day. For the continuation of the report, I'm Hyra Faye Santiago, and here's the implementation. In independent nursing interventions, first, we must establish rapport to provide comfort and cooperation with the client. Next, monitor verbal reports of pain, noting specific location and intensity, using 0 to 10 scale. Note factors that aggravate and relieve pain. The rationale for that is pain is often diffuse, severe, and unrelenting in acute or hemorrhagic pancreatitis. Severe pain is often the major symptom in patients with chronic pancreatitis. Isolated pain in the right upper quadrant reflects involvement of the head of the pancreas. Pain in the left upper quadrant suggests involvement of the pancreatic tail. Localized pain may indicate development of pseudocytes or abscesses. Third, maintain bed rest during acute attack. Provide quiet, restful environment as it decreases metabolic rate and GI stimulations and secretions, thereby reducing pancreatic activity. Fourth, promote position of comfort on one side with knees flexed, sitting up and leaning forward. It is done to reduce abdominal pressure and tension, providing some measure of comfort and pain relief. Note that supine position often increases pain. Fifth, provide alternative comfort measures such as back rub, encourage relaxation techniques using guided imagery, visualization, quiet diversional activities like watching or listening to TV and radio, because it promotes relaxation and enables patient to refocus attention that may enhance coping. Sixth, keep environment free of food odors as sensory stimulation can activate pancreatic enzymes which increases pain. 7. Maintain meticulous skincare, especially in presence of draining abdominal wall fistulas. It is done because pancreatic enzymes can digest the skin and tissues of the abdominal wall, creating a chemical burn. For the dependent nursing interventions, first, administer medications as prescribed by the physician, such as narcotic analgesics, sedatives, and antacids. Nurses must always remember that we cannot administer medicines without prescription. Second, administer analgesics in timely manner, smaller, meaning more frequent doses. Severe and prolonged pain can aggravate shock and is more difficult to relieve, requiring larger doses of medication, which can mask underlying problems and complications and may contribute to respiratory depression. Third, withhold food and fluid as indicated. It limits and reduces release of pancreatic enzymes and resultant pain. Fourth, maintain gastric suction when used as it prevents accumulation of gastric secretions, which can stimulate pancreatic enzyme activity. And last, prepare for surgical intervention if indicated. Surgical exploration may be required in presence of intractable pain and complications involving the biliary tract, such as pancreatic abscess or pseudocyst. Lastly, evaluation. For short term, after 6 hours of nursing intervention, client reported that pain has decreased from scale of 10 to 3, which indicates that pain is moderately relieved or controlled. For the long-term goal, after 24 hours of nursing intervention, the client is free from pain. Both goals were met. For the next NCP, we have here the NCP for ineffective breathing pattern related to severe pain and elevated diaphragm. Let's start with assessment. Subjective cues. Hinihingal ako at nahihirapan huminga dahil sa sobrang sakit ng itaas na bahagi ng tiyan ko, as stated by the client. And pain scale score of 10 out of 10 according to the patient. For the objective cues, abnormal rate, rhythm, and depth in breathing, dyspnea, nasal flaring, use of accessory muscles to breathe, and elevated diaphragm as seen on chest x-ray result. And vital signs are taken as follows. temperature 36.9 degrees Celsius, respiratory rate 10 cycles per minute, pulse rate 102 beats per minute, BP 129 mmHg, and oxygen saturation of 90%. And next for the diagnosis, ineffective breathing pattern related to severe pain and elevated diaphragm as manifested by reports of pain scored 10 out of 10 using pain scale, abnormal rate, rhythm and depth in breathing, dyspnea, nasal flaring, and use of accessory muscles to breathe. For the next reporter, we have here Ella Rose Joy Santiago.